We're working on a therapy that uses cells taken from the nose. This has a long history of research from around the world. In the 1990s, these cells were first reported in the scientific literature. And in 1998, it was shown that these cells can be taken from the nose and put into the spinal cord to repair spinal cord injury in rats. Then in 2002, the world's first blinded human clinical trial, led by Queensland's own Alan Mackay-Sim, showed that using these cells was safe for use in humans. And then because of his work, people from around the world continue to work on this therapy. In 2012, a study from the University of Cambridge showed it can work in dogs. In 2014, it showed it can work in a human. This is an amazing moment in science because it showed that repairing the spinal cord injury was possible. We came into this program at around about 2015 when the Clem Jones Centre was started. And we looked at the therapy in its current state and worked out what did we need to improve to make it better, to make it more effective in more people. And what we've done is invent a powerful technology that we call nerve bridges. So we come into this with our invention using a technique that we call BioBuilder. We can make large, complex cellular nerve bridges. It's fast, it's cheap, and it's effective. Importantly, these stable nerve bridges allow the surgeons to place the cells directly into the injury site where they can maximise their location to where they're needed, and also they have stable connections that allows the cells to survive. So how do these cells work? This is a video of ants across an injury, across a gap. And you can imagine in the spinal cord there's a gap and we put our cells in. Each individual cell might have to fight for its survival, and on its own it can't do it. It's only when they work as a team that they can bridge that gap. And by putting that nerve bridge in before, by putting that nerve bridge in right at the very start, we can accelerate that process. And so you can see here with the ants, they are forming this bridge. Some are forming the bridge while others are crossing over it. It's the same in the spinal cord. We have a permissive bridge that allows those nerve cells to grow across along with other cells. That's what we're creating with our cells. So now we're at the point, we've done the animal work, and now we want to go to human clinical trial. So our therapy looks like this. We will have people who've got chronic spinal cord injury at least 12 months after injury. They will do a period of prehabilitation, so exercise-based rehabilitation before the transplantation. During that time, we'll take a biopsy from their nose, purify the cells, make the cellular nerve bridges, and then we'll transplant them into the spinal cord. That's with open surgery, so the surgeons can see that injury site and know exactly where to place the nerve bridges. And then people will continue on with rehabilitation for another 8 months after that. And then once the cells are put into the spinal cord, they work in a way that allows those nerve cells to repair. And so this is an example of a schematic of a spinal cord. And you can imagine it's been got a gap in the spinal cord. The cells there, the nerve cells, do want to grow across that gap, but they can't because of the physical cavity there, but also because there's scar tissue formed by the astrocytes. And so the neurons coming down and interneurons all around, they want to grow, but they're prevented from doing so by the scar. So we can come in with our cells, which are injected as a nerve bridge into the injury site. They'll then migrate out of that nerve bridge and integrate with the host tissue. And then once they've integrated and formed that bridge across that tissue, they can merge within the scar and allow those nerve cells that want to grow across to come across and then form connections. And then with long-term rehabilitation, the body can make sense of those connections and hopefully restore function.